Wow, today I have something extremely valuable. If you are a singer, if you do broadcasting, and you have laryngitis or hoarseness or raspiness, any of that stuff, I'm going to show you how to get rid of that extremely quickly. Most of the time, you can get rid of it in 60 seconds. This is a technique that I use in practice where I started having all sorts of opera singers fly in from all over the place to get this done. I'm going to show you exactly how to do it step by step. It is so simple. What you do is you take the area of dysfunction, let's say it's right here, and you just work on the opposite side. And one big structure that I didn't really understand until recently is the fascial connection between the vocal cords and how it connects to the vertebrae right next to it. So I think what's happening with this technique is you're basically affecting fascia in the back part to create space in the front part. It opens up. With air going through it, you can control the pitch and the volume of speech and singing. The vocal cords are an amazing thing because they are affected by emotions. And you can listen to someone and really pick up their emotions in their voice. The vocal cords have an amazing ability to repair, but they do get inflamed. They do have a mucus layer that actually protects them from dehydration. But the vocal cords and the voice box are part of a larger fascial structure. So let's dive right into how to do this technique, okay? Number one, you want to locate where the problem is, like in the front part here. And then you want to draw a circle all the way on the back part, okay? And if you're going to have someone else do this technique, you're going to then have them put their two fingers, and then we're going to come in and we're going to press while we hold the head. So I have another diagram I found, but you might be pressuring a little higher or a little lower depending on what's going on right here. So we're going to press into this area and we're going to hold it for 1 to 2 minutes. So what I like to do is I like to ask them, is this tender here? They go, no. How about here? No. How about here? Yes. Okay, good. I'll be working on the most tender spot for 1 to 2 minutes. Most of the time, it's like, wow, it was a 10, now it's a 5. And then you're going to ask them, did it move down or up? Or is it still in the same spot? Because sometimes you might not be on the epicenter of where you need to be. Then you go up and you find the other spots and you press and hold for 2 minutes. The person's going to feel like you just opened up more circulation, more blood flow, more space in this area without messing up their hair. Very important. You can actually lay down on this device and have this tool press on these areas on your back of your spine. Now that you know how to do this technique, all that I want in exchange is for you to comment down below and tell me your results. Hey, Dr. Berg here. In this video, we're going to show you something extremely powerful. In fact, it borders on magic. Now, what we're going to show you to do is how to improve and fine-tune your vocal cords and actually improve laryngitis, sore throats, hoarseness with your vocal cords. And this is great for if you're a singer. I've been doing this for the last several years on opera singers from Juilliard, university instructors for singing, vocal coaches, singers all over the place. And so what you're going to do is I'm going to show you how to do this to someone else and on yourself. And here's what happens. A lot of times people get laryngitis and then they have to take an antibiotic or take a steroid. And I think that's why a lot of opera singers are very, very large, because steroids have a side effect of weight gain. But steroids are adrenal hormones, and the reason why they do work, yet have side effects, is because the adrenal gland is intimately involved with your vocal cords. They have receptors for steroids. So steroids are adrenal hormones. And so what we want to do is we want to give you some natural solutions. Now, this is in no way, shape, or form used to a substitute of treating any type of disease or illness. So I'm not claiming to cure your viruses or your bacterial infections. So that's not what we're doing. But this gives you an alternative. Okay? So let's say you had a sore throat or laryngitis or hoarseness, or you just wanted to fine-tune your vocal cords. Typically, what happens is viruses can come out of remission when you're stressed and lodge into the vocal cords and actually cause the whole vocal cords to shut down to the point where you can't talk anymore. So viruses, you can't kill them because they're not alive. They're a piece of genetic material wrapped in a sac that come out of remission and go back in the remission depending on the state of your health or stress level. So here's how it works. If we go backwards, there's always something that lowered your immune system, that made you susceptible to pulling in that virus or weakening your immune system. So there's always an earlier stress event that very few people look at. So we have the stress event, lowered immune system, boom, you get sick or the virus, whatever the cause is, okay? So we're not treating this stuff right here. What we're going to do is remove the stuck stress that actually lodges in the throat. So we're going to show you how to do this in the next video. And make mental notes, because if you ever have a laryngitis or a sore throat, apply this. And it usually takes about 2 minutes to improve this. So it's very, very fast. It doesn't have to take a long time. And all we're doing is removing stuck stress within the vocal cords, but we're doing it in a unique way. So check this out. Okay, so in step one, what we're going to do is we're going to locate where the person has the sore throat or laryngitis or a tickle or any type of hoarseness. And usually it's going to be right down here by the vocal cord. So you're going to have them point to where it is. And then what we're going to do is we're going to draw a line around the back of the neck. So I'm going to actually have you sit this way. Let me move the chair this way here. Okay, good. All right. So we're drawing the line. They're going to point right here, and we're going to draw a circle right around the back of the neck right here. And there's usually a little bump right here, okay? And then you're going to come up about 1 inch. That's right at the back of the vocal cord. So we're going to take our 2 fingers, our middle finger and our thumb, and we're going to press kind of down. I'm going to take the other head and stabilize the forehead as I press into the opposite part of where their vocal cords are. And the most important thing you need to do and remember is make sure you do not mess up the person's hair. And I'm going to hold this pressure, you can see right here. I'm going to push pressure there. I'm going to hold that for about 2 minutes. Now what's interesting about when I do this is that sometimes you're going to have to be a little higher up, because sometimes their irritation is a little higher in their neck. So you'll try to find out where it is, and then when you press, the way you know you found it is it's going to be very, very sore. In fact, more sore than the sore throat. So there's going to be a hot spot through here. So you're going to press on the soreness, use pressure to their tolerance, and you're going to hold this for about 2 minutes, okay? And then you're just going to ask them when the soreness goes away, and then you can stop. Now, if you want to use a device, you can use this on yourself or on another person. This is a device that I created, which is a kind of a do-it-yourself acupressure device. It looks like this. It's a tripod, because you could literally put this in the back of your neck and lay it on a couch or your pillow on your back and let gravity put pressure on your neck. So with her, because her neck is fairly thin, we can use the real small little spaces right here. If the neck is bigger, we can use this right here. So we're going to press right into this spot here, and this makes it really easy to apply pressure. And we're going to hold this for about 2 minutes, and it's going to be a little sore, so adjust the pressure based on the person's tolerance, and then you're going to ask them when that soreness goes away. And if they have laryngitis, you're just going to kind of test it, maybe have them count to 10 or something like that, and it's going to improve the quality of that voice. If they have raspiness, or let's say it's a little tickle, the key is having a point to where it is, go exactly opposite, press opposite point, and hold this for 2 to 3 minutes. And you're going to apply this pressure at least 3 times a day for a couple days, and that should clear it up. On many cases, all it takes is like 1 2-minute acupressure to actually clear up the throat. So again, we're not treating the virus. All we're doing is removing the blockage by working on the opposite side of the blockage. So go ahead and apply this. Send me your comments below this blog, and I will see you in the next video.